Very good, very good. Good evening. It is a pleasure to be with you as always, especially on nights like tonight when the topic really is empowering you. On behalf of Alpha Phi Alpha's General President, Brother Dr. Willis L. Lonzo III, I am Dr. Jeffrey Sterling, Surgeon General for Alpha Phi Alpha Fraternity. This is good. We want to empower you, and again, the topic is on mental health, which we've addressed on several occasions. But we want to give you some tips tonight that really will empower you to recognize early symptoms and to engage in some self-coping strategies that will help get to you before you have to get to some place that deals in emergencies. Allow me to introduce tonight's moderator, Alpha's Deputy Surgeon General for Mental Health, Brother Ron Kennedy Bailey. Brother Dr. Bailey is the Kathleen and John Bricker Chair, Professor, and Head of the Department of Psychiatry at LSU Health Sciences Center. He is also the Chairman of the Board of the Cobb Research Institute and the past President of the National Medical Association. We're proud to have him as Alpha Phi Alpha's Deputy Surgeon General for Mental Health. And as you know by now, if you've watched any of these, our mental health conversations are both empowering, engaging, and all empowering, engaging, and entertaining. So Dr. Bailey, welcome and have a great show, and I'll see you on the back end.
Well, thank you so very much, Brother Surgeon General Jeffrey Sterling. Jeff Sterling and I have known each other for the better part of 3 decades. Did a show together here just recently, discussing issues regarding being in the SNMA, Student National Medical Association, in the late 1980s. Thank you so much for your leadership, I think, in this world, in this business. And I also want to thank our brother president, Willis Lonzo, for having the foresight to initiate the idea. I think the implementation was come about from really excellent leadership from Brother Sterling. So I'm Ron Bailey, as Brother mentions. I'm currently chairman of psychiatry here at LSU School of Medicine in New Orleans. I also I played the alpha role at Morris College in Atlanta in spring of 1984. Currently a member of Omicron Psi Lambda here in New Orleans area. Been here for about a year, and I'm very happy to be participating for a better part of now almost 2 years in this Surgeon General's initiative. As I often say in my introductions, this initiative was as important to me then, almost 2 years ago, as it is now. It started off with an idea of discussing healthcare in the Black community for Black men, by Black men, especially alpha men. I've learned as much as I've gained. I think we've appreciated, of course, a variety of topics over the course of a year. And tonight, as Brother Story points out, no exception, have 2 outstanding alpha brothers, both physicians, psychiatrists in the business of mental health. I'm going to give both a full introduction, and then we move to the other panel questions. Both are friends. With Steve Bryant, I've known for 2 decades. We shared responsibility together on the APA assembly in leadership, and now he's a leader in the Black Psychiatrists of America organization. Very happy to have you today, Dr. Steve Bryant, and very proud of the work you've done. My introduction: Dr. McLeod Bryant was born and raised in Binghamton, New York. To the University of Rochester, was a member of the Mu Sigma chapter of Alpha Phi Alpha Fraternity Incorporated. He received a BA degree, magna cum laude, in cybernetics. He received his MD at the University of Rochester in 1984. He completed his residency in psychiatry at the Tufts New England Medical Center in Boston. After finishing his residency in 88, became a faculty member of the Department of Psychiatry and Behavioral Science at MUSC, the Medical University of South Carolina in Charleston. After 24 years at MUSC, Dr. Bryant left Charleston to join our team together at Meharry Medical College. I was very happy to have him join and uplift our program. The department at that point grew as he ran the clerkship and the outpatient clinic. He left Meharry and joined the University of Miami's Department of Psychiatry and Behavioral Sciences in 2015, and currently is clinical associate professor there at UMiami. He was appointed co-chair in the Dean's Task Force on Structural Racism and Diversity, and inclusion champion for their department. Brian is a recipient of American Psychiatric Association Solomon Carter Fuller Award, really our top award for psychiatrists each year. He was very honored to receive that. As a member of the American College of Psychiatrists and president-elect of the BPA, our own Black Psychiatrists of America organization. He's married to Dr. Sarah Denard, a child analyst psychiatrist. He has three adult children, Sydney, Andrew, and Erin, granddaughters, Audrey and Amelia. Dr. Bryant, I'd like to give you introductions and early comments.
Thank you, Ron. It's an honor, pleasure to be here with the Brotherhood, and look forward to being able to share some tips that will hopefully help empower not only the brothers in attendance, but other folks in the community who may be able to see this broadcast, and look forward to the dialogue that may come at the end of our comments to add further information.
Well, thanks so much. Our additional panelist is Dr. Walter Wilson. Dr. Wilson was born and raised in Brooklyn, New York. He conducted his undergraduate work at Howard University, some call it DHU, in Washington, D.C., where he received a BS in psychology. He also got a Master of Science degree in neuropsychology and anatomy from Howard in 2007 and 2009, respectively. He went on to obtain a Master in Healthcare Administration degree at the University of Minnesota, and subsequently graduated from the Stony Brook University School of Medicine in 2015. During medical school, Dr. Wilson served as co-president for the Stony Brook chapter of the SNMA, in addition to serving on the National Board of Directors of our own Student National Medical Association. He's a National Health Service Corporation Scholar and was selected for membership in the Gold Foundation for Humanism in Medicine Honor Society. From 2017 to 2019, Dr. Wilson served as a SAMHSA APA Minority Fellow and is engaged in a project focused on African American mental health and spirituality, African American mental health and psychiatric training, and the mental health of African American boys, adolescents, and young adult men. Currently, he serves as chairperson of the Council on the Minority Mental Health and Health Disparities of the APA. He completed his junior adult psychiatry training at the University of Cincinnati Medical Center, and is a child and adolescent fellowship trained psychiatrist. Got that training at Vanderbilt University in Nashville. Currently, Dr. Wilson works for Health Point Family Care, Inc., FQHC, in Covington, Kentucky. His professional goal is to operate at the intersection of mental health care, treatment, policy, administration, and advocacy for the underserved and underprivileged patient populations. Welcome, Dr. Wilson. Any comments?
Thank you for having me. Just like Brother Brian said, I'm excited to be able to kind of discuss with the Brotherhood mental health awareness, how we can make sure that we protect our mental health. So I'm excited to have the dialogue and to share the virtual stage with the two of you. So I'm excited.
As well. We'll jump right into it. I'm going to start with Dr. McLeod Bryant. Steve, three key questions. We're going to probably stick it from the top. And I think this first general question addresses much of what many of our audience come to really think about and listen and understand. It really gives us, I think, a very good starting point for tonight's discussion. And the first question simply is, how prevalent is mental illness or psychiatric concerns in the Black community, in your opinion?
So in 2020, there was a survey, national survey done by the Substance Abuse and Mental Health Services Administration, which is a federal agency that is tasked with keeping track of what's happening with regards to substance use and mental health issues in this country. And they interviewed over 70,000 people across the country, interviewed them face to face, and identified individuals by their race and ethnicity. And they found that roughly 17% of Black adults in the community, these were folks that were not in the hospital, not in prisons, but just living in the community, 17% in the past year had a diagnosable mental health condition, and another 14 to 15% had a diagnosable substance use disorder. So roughly 1 out of 3 adult Black individuals, male and female, had a treatable, diagnosable mental health condition.
Well, that certainly speaks, I think, to the issue of prevalence and just how many people are impacted or affected. I think I move next to Dr. Wilson and just kind of comment about a question that I think addresses that concern. What then, with those numbers in play, Dr. Wilson, would you consider to be some of the challenges that Black men particularly face when seeking access to mental health care services, understanding some of the numbers that Dr. Bryan has shared?
Absolutely. And so I think there are a couple internal and external kind of barriers that Black men face. First and foremost, prioritizing internally our own mental health, right? I think men in general, and definitely Black men, men of color, tend to prioritize many other things before we even start to think about our own mental health, whether that be the mental health of family, children, our partners. And so the first barrier that I think we have to overcome is an internal one. And so making sure that we prioritize our own mental health as equally as important as our physical health, because obviously there's an interplay there that they're very well connected. And to be very honest, as men, we often ignore our physical health as well. And so the first step, the first barrier to get over is simply to prioritize it. The second is stigma, right? And then I think of stigma and denial kind of in the same way, denying that anything's wrong. And then if you do get over that internal barrier along with internally prioritizing it, then, many Black men worry about the stigma in our community of seeking help, right? And so, that being associated with things like weakness or being able to, or thinking about it in a way of, being able to push through it when obviously as mental health professionals, we know that there are certain conditions that you simply can't push through, and you do need help. And so I think the stigma associated with, just having a mental illness or believing that you have a mental illness and facing the community as you move forward to get services can be a huge barrier. And that's why in the literature, many of us know about the concept of John Henryism, right? And John Henry, of course, is the figure, the Black male story where he competed against a train and actually competed to the point of his own death. And I think when we apply that to the Black community and specifically Black men, we tend to work ourselves to death, right? We push ourselves through a lot of mental health issues that we should be seeking help for. And so making sure that we fight the stigma, fight our own internal sense of denying what's going on, and going out and getting help. And then the third barrier is something that I think the Black community at large has as an issue, which is just simply mental health care access. Making sure that we have those services covered by insurance, making sure that the providers that we see look like us, right? There's a lot of literature that speaks to the fact that African Americans want to see an African American in the office, right? And so just as a sense of comfort and a way of managing historical, distrust and mistrust of healthcare services and mental health care services. And so not only making sure that there's access, but making sure that we have providers that look like us, as well as, or at the very least, providers that are with cultural humility and cultural competency to be able to understand the nuances of what Black men experience, which includes racial stress and things that are very specific to our faction of the community. And so those are challenges that I see as for Black men to move forward as far as mental health services. Definitely something that we can overcome, but and definitely not an exhaustive list either. But definitely can be barriers to the detriment of our own mental health improvement, mental health wellness.
I'm going to put that question to Brother Brian as well. I think this issue of challenges can be fairly extensive for many. Would comment that both of you share some remarkable similarities, but there's certainly some differences too. Brother Wilson's in Kentucky, Brother Bryant's in Florida. There's some differences geographically. One does wonder about differences as well. I think in regards to what area of medicine you're in. Dr. Wilson, Brother Wilson is a child psychiatrist. Brother Bryant worked, I think, in community health and overall general psychiatry, educational work throughout his career. Maybe some different challenges come into play in that regard as well, based on some of the differences in places where you actually see African American men. Brother Bryant, any thoughts?
Yeah, I want to dovetail on the point that Walter made with regards to sort of the internal and external factors. I think one important factor there is just recognizing the self-recognition that something's wrong, and hopefully we can talk in some more detail about what are some of the signs that would be that would help somebody recognize, because oftentimes when we're struggling from the day to day at work or with family or in school and whatnot, we may not realize that our mental health is suffering. And so having some recognition so that we know that, oh, we should be looking for something and that we do need to perhaps seek help is an important aspect of that internal obstacle. And externally, as Walter alluded to, was access. And one of the leading reasons, or two leading reasons for having difficulty accessing the system, one is cost. If one doesn't have insurance, or if one is so-called self-pay, where they have to paying out of pocket for services, that can be a real deterrent or barrier to getting help. And the other issue regarding access is knowing where to go. One of the leading concerns for folks in the community, as was reported in the SAMHSA survey that I mentioned earlier, was not knowing where to get help. Even though they had recognized that they needed help, they weren't concerned about the stigma so much. But who do you turn to? And that's something else that we can perhaps dive into.
Well, this is a good point. I clearly think that issues of access, issues of cost, I love are substantial. I love the point that I guess Brother Wilson, you mentioned issues regarding stigma. I often comment that throughout the entirety of my now 30-year career, I think that it probably is the issue that I've kind of talked about in these lectures the most, because it just kind of keeps rearing its ugly head. It's always existed, and it exists because I think much of the discriminatory bias, I think, against persons who have brain illnesses. I think it also exists because there's bias against people like us, people who treat individuals who have brain illnesses. And I clearly think that it goes all the way up the ladder. So at times, part of this difficulty may be not just what the cost of the service may be, but what the charge to the individual may be. Early in my career, we lectured a lot on the fact that co-pays were higher for mental health services than so-called general health services. I call it physical health, because certainly all these things are physical. The brain is a physical part of the body. But clearly, as well, you see very often only higher co-pays, but lower lifetime maximums and the like. So those issues, I think, kind of all come into play. So there's a substantive fiscal or financial role to be played, and I think that actually sends a signal to people that perhaps this is not warranted or not supported. That may also, I think, be part of the problem. Dr. Bryant?
I would agree. I think, as you note, the disparity between how physical health is treated versus mental health can discourage many people from getting the help that they need and deserve.
I think a second question we have on this list is, what are some possible signs that Black boys may be struggling with mental illness? I'd go to Brother Wilson first as a child psychiatrist, but I also want to make sure we want to circle back to Dr. Brother Bryant, because the reality is Miami, similar to New Orleans, where I live now, seems to be one of these cities that unfortunately is in the top 10 at least, if not in the top 4 or 5 of cities where there's a lot of violence and a lot of distributive violence, gun violence, and a lot of chaotic concerns in these settings. All issues that I think disproportionately have a potentially adverse impact on young people, and I think in our era, particularly young Black boys. I think we'll go to you first, Brother Wilson.
Absolutely. And so, one of the challenges with Black boys, and as a child and adolescent psychiatrist, being able to kind of tease out what exactly is going on is what I'll often get are referrals from schools or referral from parents where you have a young boy who's acting out, right? They may talk about or may notice like increased irritability, increased anger episodes. And what the literature tells us is that young boys tend to kind of manifest their, say, for example, depressive symptoms very differently at times than young girls do. And so for Black boys, what and boys in general, and actually men in general, you're much more likely to see irritability. You're much more likely in younger boys to see behavioral changes where they're acting out in school and people come to me and say, I have no idea why, and that kind of thing. So you have to really dig. Because as a child and adolescent psychiatrist, my motto is there's always a reason. There's absolutely always a reason for why someone is acting out, particularly young Black boys. And so looking for irritability, looking for behavioral changes, and then day-to-day functioning, just like with adults, right? If I'm able to push through my mood and go to work, that's one thing. Whereas if all of a sudden I can't get up in the morning, I can't go to work, that's another level of functioning. And for our young Black boys, that day-to-day functioning is how are they functioning in school, right? How are their interactions with teachers and peers? And that gives you two different types of information, right? When it comes to teachers and principals, these are authority figures, right? So if you have a young boy that's struggling with, following rules and things of that nature, that can be a sign of a mood issue, right? When it comes to their peers, which are not authority figures, but that's another indicator of exactly how young black boys are functioning with their peers, right? Are they getting along with their peers in a way that's appropriate? Are they interacting with young girls appropriately? And so I think those can all be signs. And another sign can be, again, we talk about in school, and the main purpose is performance, right? Performance as far as academically, their grades. Sometimes you can see grades drop. Grades are a pretty important indicator of motivation for young boys. And so I think those are things that we should look out for, particularly because when you look at the literature, again, just the scientific literature, African American boys, and I'm it's escaping me what age group, but elementary school boys, when compared to black boys, when compared to their white counterparts, when they present with mood symptoms, anger, things of that nature, their white counterparts are much more likely to end up in my office as a child adolescent psychiatrist. They see those behavioral changes as a need for treatment, whereas young boys, young black boys, boys of color are much more likely to be seen as delinquent and be referred to the court system. And so, when it comes to recognizing what's actually going on with our black boys, sometimes it means them going to my office versus going to juvenile hall, right? And so these are really important things to recognize. And many of us, obviously, I'm talking about schools, but many of us may be teachers. Many of us have sons, right? And so being able to identify exactly what's going on with that child based on some of the things that they're showing you, and not necessarily moving to or getting too caught up in the behaviors, even though that's kind of what grabs your attention initially. And so those are a couple of things that may give you an indication that something is going on with the black boy, at least to the point where you should inquire and respect and validate the feeling or whatever's being manifested. And so,
Brother Brian, any thoughts?
Yes, I wholeheartedly agree, and I like the point being made about sort of that the diversion of mental health issues or problems into the so-called school to prison sort of pipeline, where black boys who are having difficulties, emotional difficulties, get steered into a different pathway than their white counterparts. And I think going back to your original question, Ron, about the violence that we see in many of our big cities related to black boys as well as black male adults. A lot of this is sort of society or environmental pressures, and label it racism or prejudicial, discriminatory observations of different behaviors and steering people into the criminal justice system, steering them into confrontations with police and authority figures, and that leading to the high levels of incarceration of folks who have mental health problems but are being steered in the wrong directions.
Yeah, I think that a follow-up question really addresses what may start that process that you guys are beginning to address. And I'll also add that this week, in fact, today, the meeting of forensic psychiatrists started here in New Orleans. It's the APPLE, the American Academy of Psychiatry and Law. I'm a trained forensic psychiatrist, but I think that practically all of us in communities that I think that have these challenges and have young black boys end up one way or the other addressing some forensic issues, whether we want to or not. And there's a lot of discussion, even in today's luncheon meeting, by a guy. I'm not sure he's a brother or not. I'm sure you guys have heard of Brian Stevenson. He's an attorney. He went to Harvard, his big name, big career, and he went back to his home state, I think, of Alabama, to really work in the trenches, dealing with individuals who are essentially on death row. And he's really made a phenomenal 2 or 3 decade career out of it. And during the keynote luncheon, he actually spoke about this idea that many of us, and of course it was a mixed audience, I'll put it that way, need to be in the game and be in play. and really work inside the system to try to change these elements of discriminatory bias that all too often has young people, young men, generally blacks and browns, young men of color, overly incarcerated, overly arrested, overly adjudicated, overly punished, all too often not really be able to have active voice, I think, in that setting. So cats have a remarkable role to play, an opportunity to have touch points in that system really all the way throughout, whether it's a civil commitment right on up to issues regarding punishment or capital punishment. So I just say that I think that both of you would hit some salient points and things I think our audience should be mindful of. These are issues that we should all have some sensitivity to because they clearly have had a remarkably substantive impact. I'd argue even a fairly adverse impact over decades, over some generations now, of too many young African boys who when involved in these ages where things happen. I thought Walter mentioned that you have some irritability and some change of behavior. Very often they're punished with punitive measures rather than being treated clinically. So I think huge and important points and things that I think certainly resonate with our audience. I'm going to come back to, I think, Brother Steve, your issue regarding risk factors of mental illness and poor mental health outcomes in Black men follows, I think, along that line. And I'll throw a few terms out that I'd love for you first, and then we'll go to Brother Wilson later. These terms, I think, are increasingly discussed a lot. I want our audience to kind of think through how we as psychiatrists hear them, what they kind of mean to us, and how do you think it really plays out in your day-to-day practice and the work you do, essentially in a large hospital, in a very large city that I imagine if you're in Miami is very multicultural, very diverse, diverse of race and gender and geography and language and religion and culture. If we and these terms are social determinants of health, and we're going to next move to political determinants of health. This issue about risk factors of mental illness for Black men is one I'd love to kind of tee up for you to discuss. Dr. Bryant.
Okay, thank you. There's a question in our in the chat from Jonathan Ward that I think we'll touch on these issues. He's asking, what are the other contributing factors besides substance use that can lead to mental illness? And he comments about the fact that in his particular family that mental illness runs in the family. And so I'll begin there. That typically as psychiatrists, we look at any particular person's problems from essentially three different dimensions: biological, psychological, and social. And I'll focus on the sort of the biological and the social as contributing to causing a mental illness. And there are lots of things besides substance use that can lead to problems with one's mental health. Biologically, there can be a genetic predisposition to, in certain families, certain genes that have been associated with difficulties with mood or difficulties with anxiety and so forth have been found to be passed down, and that can lead to a predisposition for mental health problems. They're not necessarily causative. It's not like, having some like Huntington's chorea, which is a neurological disorder, which is a dominant gene that if you have the gene, you're going to have problems. These are multifactorial, but they can lead one to have a predisposition. So if there's the right stress, the right environmental situation comes along, that can lead to problems. Other biological components is poor health. Having medical illnesses that are poorly treated, like diabetes or hypertension that's out of control, or various medical conditions that again in our population can lead to having poor health just in general. It's part of the reason that we as Black men live a decade less long than our white counterparts. Our average length of lifespan is basically 10 years shorter than our white counterparts. And part of that is due to other medical concerns that interfere and can lead to poor mental health. On the social side of things, some of the things that predispose to mental health problems are, economic strife, economic disparity, the difficulties in, having stable housing or living in neighborhoods that have good access to the grocery stores that have healthy foods at a reasonable price, having problems with just having the financial resources to pay for health care, to support one's family. These are some of the things that can predispose and lead to problems with our mental health because of the stress that's involved.
Brother Wilson, any thoughts? This whole issue of risk factors, and we're going to next probably move to the particular terms of social terms of health, but do the risk factors initially. And some of you are. I mentioned Steve being in a large state like Florida and a big city like Miami, where I think there's a remarkable multiculturalism. But I imagine if you're in Cincinnati area, some issues that are kind of unique for your geographical area as well.
Absolutely, yeah, and I think Brother Brian kind of hit it on the head as far as some of the risk factors that we look for, obviously in the office, and it can be regional, right? I often think of, and maybe I'm moving into social determinants of mental health early. I think you said we're going to do that next, but I think culturally, when you go from region to region, state to state, it presents Black males, Black community, and all people, but particularly in urban areas, with different challenges that can potentially lead to mental illness, the development of mental illness. And similar to what Brother Brian mentioned, lack of economic opportunities, lack of educational opportunities, community violence is very much correlated with increased stress and increased mental illness in Black populations and communities of color. And so, including gun violence, which we talked about at the very, very top of the program. And so these are, things that, when we think about our environment, these things are pretty intuitive in terms of, yeah, of course they would lead to some issues if things are off. If you don't have a healthy community, it's very difficult to have a healthy community members. And so many of these things upstream and downstream tend to impact mental health or be correlated with mental health. And so we often have to look past just our offices and look into more population-based mental health data and just mental health statistics in general, to be able to understand some of the things that do impact mental illness that we may not even think about, which often leads to us stepping out of the office and being advocates and all of those things, and getting involved in things like policy and policy making. And so, those things can be very, very detrimental or even preventative on the good side of it when it comes to mental illness.
And you did mention the term social determinants of health, so we're going to go ahead and move to that. And I love to bring it up on these discussions for a couple reasons. One, it's sort of become a term of art. Many people are discussing it. So I want our audience to have an idea what our doctors think of and what our African-American mental health specialists think of in regards to what are some of those social determinants. Because there certainly are some frontline ones that we all kind of talk about, and probably some other issues that I'm not so sure many in a lay audience think of pretty regularly. And I'll go ahead and tee it up and say to you, for both of you, after you address that, I'm going to mention the part about political determinants, because it's kind of a new term of art. And I think Daniel Dawes and Most School of Medicine, a great young guy, he's really just done outstanding work and wrote the book and, got a huge amount of attention, and rightly so, because we probably have always thought about these other aspects of how the policies affect the politics of life, how that disproportionately, in many regards, adversely affects some groups over others. And for us, for young Black men, all too often, too many of the statistics are upside down. Too much of the bad stuff, and not enough of the good stuff that America and our society has to offer. And I think we, as psychiatrists, we really are right at the tip of the spear, so to speak, of being right in the middle of that action. And hopefully, we can put our heads together and find some ways collectively working together to improve the lives of young Black men within Alpha or really across the full diaspora for Black males. Dr. Brian, I'll come to you again.
All right. So, going back to something that was mentioned earlier in our broadcast, one of the primary social determinants that affects the severity of mental illness and its potential outcome is involving access and the lack of health insurance or the financial resources to take care of oneself, whether it is to go to an office to be assessed and to be diagnosed, or to in the case of psychiatric disorders, to be able to afford the medication that's been shown to be most effective in the treatment of that disorder, or to be able to afford the talk therapy, psychotherapy that typically involves weekly sessions with a trained professional, and just not having either the time or the money in order to be able to make full access of these effective treatments that for anxiety or depression disorder. So this a primary social determinant among many that interfere with our ability um, to to gain mastery over those symptoms that we have in the mental health arena.
Um, Brother Wilson, other comments or thoughts?
Sure, absolutely. And so, just adding to what Brother Brian said, I think, social determinants of mental health specifically has become such a hot topic because they've proven to be so important. And so, where I'm practicing currently, very low socioeconomic status, right? So when we think about economic growth, lack of economic opportunities, and specifically for children and adolescents, right, who are really kind of at the kind of, I think of them kind of like at the bottom of a funnel, right, where they're, the community and school and society is all on top of them, and they're kind of vulnerable to the like downstream trickling of all the negative things that come out of that because they don't have the decision making that adults do, right? And so they're very much at the mercy of their environment. And so when we think about the mental health of children and adolescents or black boys, and black adolescents, they're often, if mom and dad don't have a job, they're stressing the house, and that can lead to depressive symptoms. If they want to go and get a job, while they're in high school and there aren't any opportunities and they can't go to the prom or whatever it is, I mean, those are stressors. And so when you're living in a community of color where there's a lot of economic stress, it may be a food desert. Unfortunately, oftentimes educational systems in those areas are not up to par. So you have some very important aspects of your life: nutrition, education, and economic standing that can all be, kind of at odds, or in flux, I should say. That can all trickle down and cause major mental illness and mental health impact for our black youth, particularly our black boys. And so, I can't say enough about the significant impact that social determinants of mental health can have, on a population that doesn't have much say in how those things are changed. Those are adult decisions, and so that can be very difficult to kind of watch and to treat for people in our population.
Yeah, I think for me as well, I mentioned Miami and Cincinnati. I'm in New Orleans now, and I think I rarely touch any of these settings and missed the opportunity to kind of comment about gun violence. We got really involved with it. We all kind of touch it as psychiatrists, especially in our communities. But for me, about 5, 6 years ago, I was asked to give a lecture, what's called a Grand Rounds in Maryland. Bancoley Johnson, not an Alpha brother, but an African American psychiatrist, was chairman there at Maryland. And I'll say he's done me a career favor because in asking me to give that lecture in January of 17, probably about 6 months before that, in the middle of 16, I spent 6 months preparing for a lecture, and I really got to get my hands on about gun violence, and I was just shocked. One, how ubiquitous the problem is, how American this issue is. You just don't see this kind of problem in so many other places around the world that are very similar to the U.S. and SES status and some other aspects. I think of development, if we use that term, and wealth. To be honest with you, also the people who we kill. We actually kill women with guns in the U.S., and that also that did happen. I think kind of culturally in some of the other places. So this issue regarding, I think, social determinants of health are so important because for me, it does imply that some issues, such as being around violence, maybe if not just uniquely American, particularly disproportionately affecting persons in our country. And I think in this demographic group of being young African American males. And if any group should be more responsive to, if not help trying to be responsible for trying to find ways to right that wrong and change, turn the direction of that ship, it has to be African American mental providers who I think have to be particularly sensitive to what we put into so many of our young boys, and what a challenge it can be for them to straighten the ship out and not being involved in difficulty, and having safety. Again, getting back to this lecture today by Brian Stevenson. I'm on my Brian Stevenson kick today. He gave a lot of anecdotes of his experiences. A lawyer going on a death row and do that work for, again, 2 or 3 decades. He kind of talked the story about going to places that give discussions to young African males, and people saying to him at 12 and 13 and 15 years of age, I know I'm going to go to jail at some point. Or I'm not going to live past, 20 or 30 years of old. Things that even in my own life as an African male, I never really thought or experienced. I don't think I knew people who thought I experienced life in that from that vernacular perspective. But boy, sure, it's a bit more than shocking that many young people think that, and you can only imagine that may be one reason why some of the adversities and the actions that come out of many of our young people do occur. Because what persons are thinking about can be their long-term objectives and their long-term trajectory, I should say, in life. So it really resonates a lot to me, this issue of social determinants of health, and we can kind of circle back to that again later if you have some additional thoughts. I'm going to go ahead and move the conversation to prevention. And one of our questions is, what are some preventative measures that boys and men can take to protect their own mental health? And that certainly does speak to the issue of whether or not we are as protective of our mental health as we are of our so-called physical health and things that we would do physically and the like, whether it's going to the doctor or getting screened, the case may be. What do your people do to address their mental health? Again, I'll come to Dr. Bryant, Brother Steve Bryant.
So I think a lot of what we do to take care of our physical health will relate to our mental health. And I kind of lump it all into healthy habits. Having a routine of getting a good night's sleep, for instance, so critically important. We've learned that, over the past few decades, medical science had, in a sense, ignored, sleep and its importance. And, you would figure that something that we do a third of our life, basically it must be important for something besides just, getting rest. And what we've learned is that getting a good night's sleep is so important in terms of maintaining both our mental and our physical health, and getting, regular time to bed and a regular time to get up. That's a healthy routine, a healthy habit that takes care of both our bodies and our minds. Other routines, such as, regular physical exercise, good aerobic, moderate exercise. Doesn't have to be, you don't have to be in the gym 7 days a week, but, at least, 3 times a week for, good, 45 minutes to an hour of, a good workout that, you get out of breath a little bit, work up a sweat. That's something that has been helpful in terms of maintaining one's mood and lowering anxiety. Healthy habits regarding substances, no smoking, moderate alcohol use, staying away from illicit substances. That's, an important part of maintaining one's physical and mental health. Safe sex practices, not being overly promiscuous, and being protected, and having sex with others who, may not be have an intimate partner that, their sexual history and whatnot. That's important, as HIV and some of the other sexually transmitted diseases continue to ravage our community, and has important physical and mental health consequences. So those are some of the things that that would begin having those sort of practices on a daily, weekly basis to maintain one's health is critical to beginning to prevent some of the negative consequences of poor mental health.
Yeah, clearly, I think that this issue regarding prevention really begins to raise its head now, as there's a substantial discussion of what society can do, what communities can do to kind of foster health. I'll kind of swing a little bit to a different topic, and a subtopic of this issue, and the issue of burnout comes into place. And in our own profession in healthcare, a lot of discussion now about burnout, and even a fair amount of literature on how people choose medicine differently than they did in the past. And who wants to work, not only 40 and 50, but 60 and 70 hours, if not more, a week. I think the whole idea of residency. I think our lay audience is probably aware that physicians do this thing called internship. If you've been under the details, but they do know it's an early pledging like process, if you will, where you're putting in long hours and you're learning and growing before you become a doctor out and kind of practice on your own. And increasingly now, my experience has been not just here in New Orleans, but I've been for about a year or two. A lot of young doctors. We've got a big residency here, 20 residents a year in general psychiatry and the fellows. But even a lot of my junior faculty, I think people are kind of reneging against that and giving us some resistance, some pushback, some difficulty accepting these long hours away from family and friends and missing a lot of activities that I think historically many persons in our profession, physicians, have a kind of experience. So this issue about preventing difficulty with health and mental health concerns and addressing concerns regarding burnout kind of also comes to mind. And I'm interested in your thoughts, really, both of you. Just this idea that we may be in a different era now, and how does that actually impact African American men? Thoughts, either of you?
Absolutely, I can start that one off, and I think burnout has, like you mentioned, in the field of medicine, it's been such a hot topic because we're paying so much more attention to residency and residency hours, and when you get past residency and just your clinical hours and being able to manage that emotionally and physically. And I think when we talk about burnout, but if we step outside of the field of medicine and just talk about burnout for Black males in the community, I would want to reiterate something that I mentioned earlier, which is prioritizing yourself internally, right? The first thing is to recognize when you're burnt out. And many of us generally don't know what that looks like, right? We may be, very competent in our jobs. We may be doing everything we can do for our families and hitting on all cylinders and performing very well, but we may find that we're more irritable, right? And so, and that's not necessarily us, or we're much more fatigued, which is something that they see in men that tend to be more burned out or even be developing a mood disorder. And then Brother Brian mentioned sleep, which is incredibly important. If you see disruptions in sleep, you need to pay attention to that. And so I think, recognizing, getting past, that I think sometimes we have an unhealthy definition of what masculinity is. And that tends to be a part of that is like, we can push through anything. And you can be tough. I think that's a very important trait for masculinity. But being masculine is also about recognizing when you're burnt out, understanding when you need to take a break, and just being able to push through some of the stigmas that come along with saying, "Hey, I'm burnt out. As a Black male, I'm burnt out. I'm working really hard." And so, prioritizing yourself internally, making sure that you're able to recognize what burning out looks like, even when you're performing on the job well, you're performing well with your family. Just understanding that if you know yourself, right, and if you're not yourself, something's going on, and it may simply be not simply, but it may be an aspect of burning out and just having more physical signs than any mental signs that you may recognize. And so, the recognition for Black males. And for us as older Black males to recognize that in young boys and tell them to take a break is also important. And so I think the recognition is important.
Come to Brother Brian, I remember earlier in the discussion tonight, Brother Wilson kind of talked about, John Henryism. As I understand it, this idea that, John Henry was so big and strong, you could put a lot of weight on his shoulders, physically, emotionally, and he kind of keep on kind of trudging through. That has to resonate at some point with some issues that Black males, colleagues of ours and friends and men in our practice, I think have experienced. I remember hearing comments early in my career, early in my life, my parents saying, and neighbors saying, if you're going to be successful as a young Black man, you got to be twice as good. That's what you a lot of details to that, twice as good as what, but it sort of gave this idea that you had to do more and not mess up. And there was this higher level of expectation of your demands on you in order to, meet a certain standard in life for yourself and your family. One would imagine over time that has to have could potentially have somewhat of a negative implication on Black males if people are hearing that and how they kind of implement it in their lives. Interested in your thoughts. That's an issue you've heard as well. And do you see that in the Black males you kind of care for there in Florida and other parts of your career?
Yeah, absolutely. It is a burden that, not only in medicine, but in many professions, whether, law, business, and so forth, where, we are held to a higher standard. Sort of the best example of this is, to me, is, Barack Obama, and, what he went through, acting perfectly, in essence, and all the crap that he received for being twice as good. He was, much more competent than, the unnamed person who followed him in the role of POTUS, and yet, he, performed at a extremely high degree, but that can have a significant toll to in essence, to be perfect, to achieve, in whatever role one is going for. And it's important, as Brother Wilson suggested, that we somehow keep an eye on balance, and oftentimes having a support network that's strong around us to keep us in check, to make sure that we're taking care of ourselves and taking care of each other and our support network, is critical. Otherwise, we can lose ourselves and fall into that burnout.
For sure. I mentioned it in part because even in my time, in these roles with these large departments, seeing persons, really a categorical shift in willingness to be on call on a weekend, for example. I left a job in North Carolina where we were paying people to be on call on weekends, and so they had trouble filling shifts. Very different than a mindset maybe 30 years ago when people were not paid and they were assigned to be on call for the weekend, and didn't whether you complain or not, it fell on deaf ears. So clearly, I think in many regards the era kind of has changed, and that kind of brings us to this issue where we discussed a little bit earlier about violence. And I know it's not all about violence, but I definitely discussed it quite a bit. And of course, with the new 988, toll-free number that's come through SAMHSA. We are addressing additional strategies to predict violence well in advance, as a suicide hotline number, or a number to address mental health crises. So I want to kind of tee that issue up for both of you, your thoughts about it. One, that we needed it because there's just a huge volume of activity needed. I think Steve mentioned at the very beginning what the prevalence numbers were, and they're probably growing. One is always concerned whether or not the numbers are even accurate in our community, or whether because of stigma, as you guys have both, I think, very eloquently tonight addressed, whether African men even acknowledge the full degree of how much they're being impacted by the stresses in many regards in their lives. So this, our third question just really addresses the concerns regarding what can be done to treat mental illness and prevent suicide. We'll get to homicide next. But I also want you to kind of comment about what role you think the new 988 hotline number will play, especially preventing suicide, and whether you think your patients, African males, will use it and use it effectively. Thoughts?
So that's one of the questions in the chat was, asking about resources that can help overcome stigma. And one of the notions nowadays is that with the technology that we have, with the smartphones, with the apps, and so forth, are there ways that we can overcome some of the barriers to make it easier for folks to access resources? And Ron, you mentioned the 988 number. That's a recent development to try to make it easy for folks. Much like 911 is universally known as the emergency number to call if you're having an emergency that you need help with. Well, 988 is now available to contact if you're having thoughts of wanting to end your life. Now, I think it is a number that one can use even if they're not feeling suicidal, but just as a way of tapping into mental health resources to get help as quickly as possible, or to get information as quickly as possible. Many communities also have the 211 number that you can call. It's kind of variable. I don't think it's a universal 3-digit number in every community, but at least in many of the larger metropolitan communities, that's another way of getting in contact with assistance with regards to mental health services and support, and getting some ideas as to how to access services. Just in terms of therapies now, with the pandemic sort of accelerated efforts to have online and telehealth avenues for people to receive services, and that's opened up a number of things online. I'm not extremely well versed in all the options, but I know, for instance, that there's a online resource called BetterHelp that provides access to therapists online that one can try to connect with to get talk therapy from the comfort of one's home. So yes, I think there are a number of avenues to try to decrease the barriers, to give folks access to prevent suicide and to help people get the help that they need.
Yeah, I'll reference some of the points in the chat. I think you mentioned a few of those earlier. I'll read them. Eric Nelson asked, what are challenges that Black men in mental health systems face? And I think that's a good question. We talk a lot about Black men in general and issues and access or whatever, but these healthcare systems can be very different and very varied. And then what are some of the systemic barriers and how can they be overcome? And I'll squeeze another one in before we go to Brother Wilson. There's stigma in our community about mental health and getting help. What can be done to break through that barrier? So it's really more solution-oriented concerns. And what have you guys seen that's actually worked in these areas? Systemic barriers in mental health systems to getting care, these challenges that Black men have, and also how do you combat stigma, especially for Black men? I mean, if your family's saying, don't deal with it. I have an uncle, I love him dearly, went to heaven a few years ago, but when I went to psychiatry 30 years ago, he made some disparaging comments, not about me. My uncle loved me dearly. And I went to med school and college and all that kind of good stuff. But when I went to psychiatry, uh, disparaging comments about psychiatry. That's certainly my experience, and some of you guys may have had the same issues of concern. So, issues regarding addressing stigma and challenges for Black men in mental health systems. Brother Wilson.
Yeah, that's a great question, and as I read the question, I'm not fully sure if it means individual Black men who are getting treatment in mental health systems or those who work in mental health systems. But I can kind of approach it from both.
Take both. That's a good point. Take both.
Yeah, and so as far as receiving services, I think Brother Brian mentioned, and I mentioned a little bit earlier. So I'm glad we were able to reiterate because these are important points. It's simply access to insurance to be able to even get to and get into some of these mental health systems, mental health care systems, and see a therapist, see a child and adolescent psychiatrist such as myself in the community. And so I think some of the systemic barriers are very much economic. And making sure that if there is a large copay, like we mentioned, unfortunately, we talked a little bit about the social determinants of mental health, and then there are the political determinants of mental health that Dr. Bailey talked a little bit about or mentioned as being more of a new term. And this is where it applies, simply because mental health parity laws that are supposed to equalize how much insurance companies cover mental health services versus more general physical medicine services should lower the cost for you, right? As an individual trying to access these mental health care systems. But unfortunately, because that parity has not been enforced, we often have higher copays for mental health than we should. And so I think one of the bigger barriers that are systemic are financial, right? Especially in some of our communities that we grew up in, right? Or that we have the privilege of serving patients in, where the socioeconomic status and the poverty levels are much lower, right? And so, and for example, I mentioned where I work now in Northern Kentucky, right near Cincinnati. And because I'm in the National Service Corps, we go to the environments or the communities that have the most need and have the most poverty. And so I see it every day, right? And so that's a major barrier that we face from a patient standpoint, right? And just knowing where the services are and then being able to pay for them, like Brother Bryant mentioned. And then from the other side, just being as a Black man working in mental health systems, I think the challenges can vary where you practice, right? Where if you practice in academia versus myself and Brother Brian, I believe we're both community psychiatrists, and so there's some leeway in certain environments where there's less leeway in others, as far as how you can practice and what you can do. But I do think as Black males in mental health care, one of the things that can be a barrier is getting people around you to recognize that racial stress for our communities of color is a real thing, right? Microaggressions are a real thing. And so, as Brother Chester Pierce, who's a Black male psychiatrist from Harvard, right? And he actually trained at the University of Cincinnati, which I didn't know that. I didn't know we shared that in common, but he coined the term microaggressions as far as things that Black patients experience from a day to day that invalidate them, that make them feel invalidated as actual Black Americans. So, from the inside, trying to get others to view that, I think we've come a long way in being able to do that. But getting people to understand from a clinical standpoint that these things are as important as any other stressor, but are specific to our communities, is something that I think Black men who practice in mental health systems face. And I think you overcome it by continuing to talk about it, right? Continuing to make sure that people understand, showing the literature about racial stress and how it can impact the mental health of Black communities, and just not being afraid to address it, kind of straight ahead and directly.
I'd like to add to Brother Wilson's comment by also talking about the challenge of being a Black male who is, seeking treatment and being perceived by the mental health professional, perhaps not in the most appropriate way. One of the challenges that we're dealing with, Brother Bailey and Brother Wilson, particularly Brother Wilson and his role in the American Psychiatric Association, is that there is a misdiagnosis of conditions that have been shown to occur with Black men because of either sort of the bias of the clinician or the sort of the expectation of what is being presented by the Black male. And that's a challenge within the system. That's one of the things that I tried to deal with trainees and trying to help them appreciate and actually listen to what the Black male is saying, and not have preconceived notions about they're coming from Overtown, or they're coming from Liberty City, so they must be X, Y, and Z, and putting them in a box that they don't belong in, just because they may be of Haitian descent, or they may be they may be transient to Miami and actually coming from Kentucky or someplace like that. But the system has a way of socializing the behavior of the clinicians that can put Black men in the box, and it's one of the reasons that I think it's important that we try to help everyone sort of appreciate what the early signs of illness are, so that it doesn't get to the point where someone is having to go to the emergency room to get their first treatment, or they're having family calling the ambulance or police to bring them in an emergency situation, because at that point the system may tend to come to conclusions, draw conclusions, and rush to judgment to the detriment of the individual who's in that situation. By recognizing early and seeking out help and being empowered to seek out the help that one feels will best help themselves, I think that's a way of getting the right help and not getting into some of these detrimental situations.
I'm going to mention another question, and I'm going to go to you, Brother Wilson, and I'm going to ask after this that I'll give Dr. Brian a chance to kind of talk a little bit about some initiatives in the BPA, the Black Scouts of America, and his leadership role, and a lot of the good work that I think the BPA is engaged in doing. I do, before I go to the BPA question, though, Steve, want to address one of the other questions. Stephen Hill asked, Charles Holloway asked about copays, and copays is a huge problem in your practice. You mentioned some issues there where you're on Cincinnati, Walter, but also Stephen Hill asked, it's difficult to address stigma and turn to someone who looks like us. And when you try to feel the provider out, and the support staff or the professional staff will ask, you're not here for blank, are you? And that resonates to me, because I've certainly worked in settings where the entire group around the individual has some reluctance or some resistance, and they send all kind of signals that the patient, if they're a Black male, should not, as Steve said earlier, seek care, if you will. It's in your thoughts. Have you seen that, Brother Wilson? And so, kind of how you try to manage it or address it? Because these may be reasons that actually decrease the numbers of African Americans actually going for care. And I really appreciated Steve's comments earlier, the idea that, if you look at the list of who lives the shortest amount of time in the U.S. is Black males, and I think white females are the longest, and it's over a decade or 10 or 12-year difference. And we maybe have a role to play as mental professionals in bridging that gap. Thoughts?
Absolutely, yeah, and I think Brother Hill, that's a great question, or more of a comment, because like Dr. Bailey mentioned, I do see that, right? I do see staff kind of put Black males in a box, right? And like Dr. Brian talked about, where when you come in, they assume they know what's going on, right? And they kind of push you towards something, and you have to, immediately, upon meeting a nurse and meeting a behavioral health specialist, you're already on the defensive, right? Well, no. Well, this is what I'm here for, and so I think that can be a big deterrent, right? And so I think from the end.
We've lost them.
I think he froze. Yeah.
Well, let me maybe follow up on that a little bit. Being able to advocate for oneself in a setting like that, it can be helpful to, if you're able to have support with you, so that if you're feeling, if you go into, say, that initial intake session with a family member or just a respected, like another brother who's there with you, and ask to have that person included as part of the assessment. They don't have to be there for the entire time, but just as a check on the system to let them know that you're not there alone, that you have support. This is a reasonable tactic. Any clinician worth their weight should be able to handle that. If they tell you that no, that's not allowed, that it's just only you that they'll talk to, then that's a signal that that's not the place where you're going to get the best help. And so hopefully you'd be able to find that comfort level where you'd be able to establish a dialogue with that support behind you, where you can get your needs addressed.
Brother Wilson, you're back.
Yes, sorry about that. And so no, and that's just to piggyback off of what Brother Brian said, and just to finish what I mentioned. He mentioned what you can do from the outside in, and I totally agree with that. I think bringing someone is a great way to be able to mitigate some of that, and make sure that there's someone else there that can hold clinical staff accountable for how they treat you. And then the obvious conclusion that Brother Brian came to, which is, and if they're not treating you correctly, go somewhere else. From the inside, addressing it with policy, speaking up when you see it, right? As a provider, it's not something that I'm afraid to do, and I'm sure the panelists that I share this virtual stage with and look up to aren't afraid to speak up if they see that as well, in a very professional manner, and say, hey, this is how I noticed that you interacted with this Black male. Is there a way that we can do this a little bit better so they feel welcomed in our offices? And so you're right. There can be a lot of judgment when a Black male walks in. But I will say that when you find a good provider and a good facility, they'll treat you just like anyone else. And so don't allow that to deter you from seeking treatment when you need it.
BPA, love to give you the floor, Dr. Bryant, and have a chance to talk a little bit about Black Scouts of America. I will admit that before we come to you, I'll just kind of comment for audience that the only mistake I think heard tonight was when young Brother Wilson said that outstanding Black psychiatrist is a guy named Chester Pierce. There's some folks who say that the most outstanding Black psychiatrist was a guy named Chester Pierce. So I just would say,
that's right.
Put that on the record. He probably is about as accomplished psychiatrists, Black psychiatrists. I think that our organization has ever seen, and we certainly give a tremendous acknowledgement and respect for all the work done by Chester Pierce. That being said, let's talk a little bit about BPA because Chester Pierce was, I think, a founding member and maybe even initial president.
That's correct, Ron. The organization has been in existence since 1969. It came out of the flames of the civil rights movement, and when a number of Black psychiatrists were dissatisfied with the treatment that they and their Black patients were receiving through the American Psychiatric Association, and formed, and the organization is continuing to grow and try to provide opportunities for helping the Black community. And in fact, we have our annual meeting is going to be next month, and we're looking forward to getting together and plan for the future and having greater outreach to assist communities of color.
Absolutely. That meeting is going to be in Puerto Rico. I certainly plan to be there. I thank you and your group for accepting a piece that we sent in on violence prevention, myself and Bill Lawson and Charles DK. So it's outstanding. We all are ready to kind of get back in some routines that we've had over our careers pre-pandemic. So post-pandemic, that certainly should be a lot better kind of going forward. Very proud of the BPA and all the work that is done, and very, very proud of you, Steve Bryant, all the great work that you do in your upcoming leadership role there. We have a hard stop at 8:30 Eastern in about 9 minutes. So I'm going to address two questions in the chat, give each one of you guys a chance to each answer one of those. And I'm going to give each one of you guys the final, minute, a minute and a half, and your closing comments. I'll go to you, Steve, first. One question came from, and I lost it just that quick. Stephen Heel said, anonymity and respect seems to be absent when it comes to mental illness, if you will. And I thought that actually was one that kind of caught my attention. This idea that people have to be, this anonymity piece. You don't tell folks you're seeing a psychiatrist when you say you're going to see your doctor for diabetes or kind of hypertension or what have you. I hear that a lot. But the part about respect is also key. And with a sense of being disrespected, which seems to be huge, I think, in our community and in our settings, so that we our practice, may also be a downward pressure for persons getting care. And I think that's one for us to think about and think through. Let's maybe come to you first with that one, Brother Wilson. Anonymity and respect. Your thoughts of how that impacts Black males getting mental health care.
Absolutely, yeah, it's huge, right? And I think we go back to being vulnerable, right? First, all those barriers, right? We have the internal barriers, we have the prioritizing our own mental health. We have to get through that barrier, and we get through the barrier of when we ask for help. How is our community going to view us? Once we push past that barrier, right, which are two barriers that are huge, then we get to care, and it don't feel respected, right? And our information isn't protected, and so I think it can be hard, because one of the hardest things in the whole process is just getting to the point where that you need help, and then getting in the doors. And if you get in the doors and you're not treated well, you're not very likely to come back. And so I think it's a huge problem. When I often talk to my colleagues, who I often tell them to think historically, right? Well, they'll say, well, why are African American males or African Americans less? Why don't they want to talk to me about things? Why do they seem more defensive? And it's because there's a history of the field of medicine taking advantage of the Black community, right? It comes honest, right? And so I often say, the 13-year-old in my office, has a mom who had a certain experience with with the psychiatric field or medicine, grandmom and all those. And those views, if grandmom and mom and great granddad didn't trust medicine and don't trust psychiatry, that trickles down to the 13-year-old in my office. And no, they don't know about the Tuskegee study, for example, but they know that grandmom and mom didn't trust for some reason, so they're not going to trust you. So that feeling of respect or lack of respect, and lack of discretion, right? When we talk to our providers, is a huge barrier, but not one that I want us to stop. For us to stop us to actually seeking care, right? We need to push through that. that's huge. I think it's a big deterrent, particularly for Black males.
And the last question out of the chat, before I give both of you guys a minute for your final comments, and then we're going to go to Surgeon General Jeff Sterling for our closing comments. But the last question in the chat, just briefly, there was a question about church. Terrence Grant said, Brother Brian, resources that you recommend for an adult church member resistant to help and not taking mental health meds can be a huge issue, I think, in our profession, in our culture. Many people go to church, and historically, some have thought that to be good with church, you were not necessarily in bed with these mental health types, if you will. I hope that that's changing in my career. Be interested in your thoughts and what recommendations or resources you recommend to our brother Terrence Grant.
Yeah, so I know that there are a number of efforts around the country to try to engage church and houses of worship in collaborating with mental health professionals, and often the most successful programs involve some education to church members so that they can operate as sort of mental health paraprofessionals, because oftentimes because of the stigma or because of fears about the system, people just won't they won't seek out the established care, but a parishioner who they trust can engage them in discussion and help be a liaison to getting the help that they need. Short of that, of having such a formalized program, sometimes engaging support services that involve peers who are engaged in their own mental health issues. Sometimes those peers can lend a hand in terms of communicating with the person who's struggling to struggling with their mental health and following the directions of their treatment team. So organizations like the National Alliance for the Mentally Ill or Mental Health America, they typically will have websites and chapters in most major metropolitan areas. There'll be support groups that are part of those organizations that perhaps a linkage can be made between this person and the support group to assist them in coming to terms with whatever it is that they should be doing or that they need to do to take care of themselves. This is a struggle not only for members in a church, but in families. Loved ones are trying to get their loved one to take care of themselves or get the help that they need, and the resistance can be high. So I know it's quite a struggle, but again, reaching out to some of these support groups in the community may provide some answers.
I will give both of you outstanding gentlemen just a wonderful discussion tonight. Maybe 45 seconds to a minute for your closing summary comments, and we're going to kick it to our Surgeon General, Brother Jeff Sterling. You want to go first, Dr. Bryant?
Okay. Well, again, I appreciate the opportunity to share this information and the dialogue with the brothers. I'm encouraged by the interest that's been shown and the good questions that have been asked. This is a work in progress. This is sort of a never-ending effort, but the more that we know, and the more that we're engaged, the more that we take care of ourselves, we can take care of each other, and progress can be made. So thank you.
Brother Wilson, closing comments?
Absolutely. And so just a quick reminder that as Black males, we are the leaders of our families, right? Many of us, we're the leaders of our, at work, we're leaders in our communities. And it's okay to be selfish to make sure that your mental health is, well enough to be able to shoulder the burden of all of those things. And so, making sure that we're not too tough to recognize what's going on with ourselves internally, emotionally, things like that, and then seeking help. And making sure that we remain strong for our communities. And so Dr. Brian mentioned help groups or support groups. As a brotherhood, I know I joined Alpha, obviously, as many of us did, because it's a support group in itself, and not necessarily for all of our mental illness or mental health needs, but definitely for support from other males that are like-minded. And so remember that as leaders of our community, it's okay to be to be very selfish when it comes to protecting our own mental health and taking it seriously and prioritizing it.
And we often end with resources. We can sort of provide the document for the entire group. There's a 1-800-suicide number for persons who may actually have questions of help. I like to always also end by just saying, I've rarely met an African physician who, if you call them and you want to talk about your concerns, they won't talk to you. So you don't have to speak just to a psychiatrist or a psychologist, even mental health concerns. A lot of this work actually is conducted in a variety of settings, although we always hope that we can work together in conjunction. Maybe you see a primary care doctor first, and they may refer you to a psychiatrist as well. We've got a very active process. I know we talked a little bit about BPA, but Steve Bryant becoming president and Napoleon Higgins, who's the executive director. The BPA has put together a really nice piece, like a national network of communications, phone numbers, so you can find an African American mental health professional in all parts of the country kind of going forward. So those are kind of my closing comments today. I think that Walter was said it well. Be healthy, be safe, and reach out for help when needed. We are there to help you. Surgeon General, Brother Jeff Sterling.
Wow, that was a very insightful and impactful conversation as promised. I'm going to take things in a little bit of a different direction. And for those members of the audience, I want to obviously be deferential to our brother colleagues who are experts in psychiatry, but I'm going to speak to you directly as a public health professional and an emergency physician. I literally spent my entire day having conversations about mental health delivery for communities at risk and for whom these social determinants of health were actually crippling. I will remind you that we come from a community that can legitimately claim to be dealing with post-traumatic stress disorder as an entire community. Furthermore, we are now in a country, and as these things go, of course, when America has a cold, Black America has pneumonia, as the saying and analogy goes. And as such, even though our community has long suffered from the equivalent of post-traumatic stress disorder, now that this country has been besieged by a few years of COVID-19, and you actually look at, I think the political data was referenced a little bit earlier, you literally have both parties being polled somewhere between 60 and 80%, saying that they are so stressed out about the upcoming election because they believe the other political party poses a serious threat to this country. So that is to say that the level of stress that exists in this country is at an all-time high, so much so that the mental and behavioral health concerns of the citizenry are at endemic level threats. So what does that mean to you? Well, very simply put, as was said, you have to engage care of your mental health as if it is health. You may have heard this term, sound body, sound mind. Those things have never been more true than they are today. I can tell you that any and every medical effort that is ongoing, and by the way, we've long done this in emergency departments where we have since through this effort and data have discovered that over 25% of women are victims of domestic violence. So continuing the point, we are now at a point to where everyone needs to be screened for anxiety and other mental health, behavioral health considerations. So if you have insurance or if you don't have insurance, for your next conversation, your next visit to the emergency department, your next engagement with a telehealth or telemedicine provider, have a conversation about mental health. We finally, because of all the things that I've mentioned that are now going on with stress and anxiety in this country, are at a place to where it's demystified and it is no longer a sign of weakness, perhaps as it has always been, to have conversations, even amongst men, even amongst Black men, to have conversations about your mental health. We need resources. We need to demonstrate that the demand is there. We no longer at the point to where we have to wear stress and anxiety and mental duress as some type of badge of honor. Get yourselves healthy, get yourselves empowered, and ask about your mental health, both with your friends, your families, and in the setting of professional engagement with your healthcare providers. It makes all the difference in the world. So, once again, as we like to say, we want to thank all of the brothers of Alpha Phi Alpha Fraternity Incorporated and those who support these webinars. We hope that this has provided you information that you can use. And just as an aside, there was one question that didn't get engaged that I will just provide because it's a very easy answer to Mr. or Brother Adedipe. If you have someone who is preparing for medical school, there's no better resource in the country than the Student National Medical Association. Google it. Student National Medical Association and the Minority Association of Pre-Health Students. That'll get you to where you need to be. We will continue to have empowering conversations on mental health. We'll see you back here in 2 weeks for another Surgeon General Initiative webinar. And in the meantime, thank you, be well, be safe, and we'll see you down the road. Good night.